Krasnodar Clinical Oncological Dispensary. The level of the quality of provided specialized service is compliant with worldwide standards. It is confirmed by the most authoritative medical organizations. The dispensary deserved the certificate of European Society of Medical Cancer. Main condition of successful treatment with modern level of medical development is an incipient detectability of growth. Local oncologists use wide variety of diagnostic equipment. They are computed tomography scanners, MR imaging installations, supersonic scanners, mammographs, endoscopic equipment. All the necessary tests to determine a diagnosis are done at the laboratory of the clinic fully. A precise diagnosis is the first step to cure. Patients with hematological diseases get treatment according to international regimens and protocols at the hematology unit of the clinic. Standard and high-dose chemotherapy are provided for the patients with acute and chronic leukemia, lymphadenoma, multiple myeloma, myelodysplastic syndrome. Also, immune therapy and biotherapy of hematological diseases and immunosuppressive therapy for the patients with anemotrophy are provided. Pharmacological therapy of the patients at all the disease states is provided at chemotherapy departments. New highly effective regimens of chemotherapy, histotherapy and immunotherapy, which make for medicinal effect for 90% of patients, are introduced in practice on daily basis. Radiological service of the dispensary uses the best practices of X-ray therapy. Intraoperative radiation therapy in case of breast cancer significantly reduces the terms of the treatment. The most advanced linear accelerators let lead the curative dose of radiation directly to the tumor, with no harm for sound tissues. High performance of delaying time to relapse and lifetime of the patients who had combined and complex treatment show the efficiency of X-ray therapy. The great Russian scientist Pirogov said that surgery is an art, which is framed by the science. The treatment of the most oncology diseases is organized with surgical interference. Minimally invasive technologies are the priority area for Krasnodar specialists. They use laparoscopy widely. All kinds of surgical measures in case of benign neoplasm and malignant neoplasms of female genital sphere are provided at gynecology department. At the incipience of the neoplastic process, in order to save reproductive function of the woman, minimally invasive conservative surgery are widely used. Specialists of the urology department provide full range of surgical intervention for the patients with oncologic diseases of genitourinary system. The methods of conservative surgery in case of kidney cancer and urinary bladder cancer are widely used. Patients with oncological diseases of esophagus, stomach, small gut, liver, pancreas gland, spleen and with extra-organ tumors of peritoneal cavity and retroperitoneum get high-qualified surgical measure at the gastroenterological department of the clinic. Oncologists of the Department of Head and Neck Carcinoma use aesthetic approach in surgical measures. Here, the specialists perform plastic reconstructive surgery with help of advanced microsurgical techniques on organs of mouth cavity, fauces, gorge with replacing of prolapsed soft tissues and osseous structures appeared after amputation of disseminated tumors. All kinds of the diseases of skin, soft tissues and bone tumors are treated at the clinic. Combined methods of treatment with use of gamma-ray teletherapy, polychemotherapy and immune therapy are used widely. Department of General Oncology specializes on the treatment of extra-organ retrocecal tumors, benignant and malignant tumors of segmented intestine and straight intestine, canalis analis and perineum. Patients at the age of 75 with serious comorbidity have treatment here. Experienced oncologists perform all kinds of surgical intervention on mammary gland. About 4,000 interventions are performed each year. Also, single-step mammoplasty on mammary gland after its complete amputation. Department of Coloproctology specializes on performing standard and unique surgical interventions on segmented intestine and straight intestine, canalis analis, pelvic organs and retroperitoneum, and also on reconstructive and reparative interferences after wide exsection of large intestine. In case of colorectal malignant tumors, minimal invasive interventions have definite advantage over open surgery. Robot-assisted surgical system Da Vinci has been successfully performed since 2015 at the department. Thanks to mastery of the specialists and qualified use of advanced methods of the treatment at the Krasnodar Clinical Oncological Dispensary, patients with malignant tumors get real opportunity to recover from fatal illness and come back to full life. It is thought all over the world that a person who has passed 5-year-long line since the moment of the oncological disease had been detected and has had a full course of treatment is cured. Amount of such patients in Krasnodar Clinical Oncological Dispensary has significantly grown within last several years.